Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloud9 Sarjapur and Bellandur in Bangalore. Today let's discuss about the tests to be done in antenatal period. So the whole 9 months, so many tests, when to do what, why it is done, it is very important that you are aware of. Okay. So in the first visit, whenever you are meeting your doctor will ask for complete hemogram, thyroid, sugar, HbA1c, postprandial blood sugars, urine routine, and what is your blood group. This is the minimum basic test along with the serology test. This is serology is HIV, HbSAg, VDRL, HCV tests. Why these tests are done? Because we take different cutoff for the thyroid sugars and all in pregnancy. If thyroid is high, some labs take 2.5 as the cutoff. Our lab at Cloud9 we take as 4.3 as the cutoff. So if anything above this, if it is there, we start a low dose thyroid medicine. Okay. Why thyroid medicine is important is because thyroid TSH being high can impair the cognitive functions, risk of bleeding, sometimes risk of miscarriage. These research studies tells. So always when your doctor tells to take the thyroid tablet, don't worry, it is not for the lifelong, at least for the pregnancy and 6 weeks to 3 months post delivery, you have to continue the medicine. There is no harm, it will not cause any side effects, nothing. So don't worry and start the thyroid medication when your doctor tells to take. Sugars, we usually want the fasting to be less than 95 and after 1 hour of food to be less than 140. Why sugars are important? Because we Indians, being the South Asians, we are genetically at risk of developing diabetes in pregnancy, and because of the pregnancy hormones influence also, sugars can vary. So if we know what is the baseline, later to treat, it will be evaluate, it will be easy. So for that, sugars are important. And blood group, why is it important? Because there are women with Rh negative pregnancy. If negative blood group is there, then we ask for the husband's blood group and do indirect Coombs test. ICT test is done. Okay. Why this ICT test? To know already any antibodies are present in the body which will cause problem, and serial monitoring, these things have to be done. So for that reason, what is the blood group of the woman is very important. The HIV tests and all, why is it important? And if it is positive, at 12 weeks afterwards, we start the treatment for the woman to prevent intrauterine transmission of the disease for the baby. So for these reasons, these are the first visit tests, and there will be ultrasound to diagnose where is the pregnancy developing. These days, ectopic pregnancy, the pregnancy in the tubes, ovaries, or in the previous cesarean scar or in the cervical area, abnormal location if it is there, it is called ectopic pregnancy. So that is increasing. So for that reason, early ultrasound to see where is the pregnancy developing, and 7 to 8 weeks to check the fetal heart rate, that ultrasounds will be done. Then the ultrasound will come is the NT scan, nuchal translucency scan, between 11 to 13 plus 6 weeks of gestation. That is the time where we do. And anomaly scans around 20 weeks. In between this, if the patient has any bad obstetric history, cervical incompetence or any pain or any fibroids which is causing pressure, or any woman who comes with the pain in the pregnancy, we do recheck the cervical length at 16 weeks of pregnancy. If not, the anomaly at 20 weeks, 28 weeks, the growth scan will be there. Fetal echo at 23 to 24 weeks, we are making it routine, because the fetal echo after birth, if any abnormalities in the baby heart, any issues are there, that we have the baseline fetal echo scan. So it is better to do fetal echo at 23 weeks of gestation. Then the growth scan at 28 weeks, and the term scan at term, maybe 37, 38 weeks. In between, it depends whether the fluid is fine, if the growth is less or any problem. In between, the doctor will advise for the scan. Apart from this, there is some genetic tests which we routinely advise. First trimester quadruple marker, which is done along with the NT scan, and HB electrophoresis. HB electrophoresis is a basic test which tells any hemoglobin defects are inherited by the woman. So many times women will not know that there is minor carrier genes which are positive in her, which can be inherited to the baby. If both the partners are carriers, the baby will be affected. So for that reason, routinely HB electrophoresis test we do for the pregnant woman. Then that if it is normal, it is fine. If husband also is a carrier, then we have to do the testing for the baby. Intrauterine only we have to do the testing, and we have the facilities for that. Apart from this, whenever each visit, each trimester, at 20 weeks, we do the CBC, thyroid we will repeat, liver function test, and glucose tolerance test, because by 20 weeks the maximum effect of pregnancy hormones will influence the sugars. So if any risk of diabetes, that also we recheck. And at 28 weeks, if the woman is Rh negative, we do the ICT test and give the anti-D injection, which will prevent the antibodies formation. And then we have the near to the term CBC to check what is her hemoglobin, sugars, what is happening. Sometimes late onset of fluid becoming high, or the baby growth is more. So these kind of scenarios will happen. So the AFI, when we see in the growth scan, they can tell above 20 is more. Okay. So if we see the report of 24 AFI or 19, 18 if it is coming, we do recheck the sugars. Glucose challenge test with 50 grams, we give glucose and check irrespective of the last meal, and 1 hour post if we check, if it is more than 140, it is considered as impaired sugars, and we put them on diabetic diet. So sugars can come in the early phase, in the middle, or in the late phase also. So always not to eat excess sweets, excess rice item, reduce the carbohydrates, more of protein rich diet and fiber rich diet consuming is good for the baby. Okay, mainly focus on the protein, that is very important for the nutrition of the baby, than the sugars. Simple sugars like drinking juice is not good. Taking the full fruit is good for you and the baby. And next is the test when we come near to the term. Anesthesia checkup we will do routinely for all the patients. If the anesthetist feel the BP is developing, any problem is there, maternal echo, ECG and cardiologist opinion we take around 32 to 34 weeks. There are some women who are pre-existingly, they have the renal disease, their kidney function, ultrasound abdomen kidney we will do if their renal function are impaired. Or there are women who have already ovarian cyst with the pregnancy, then the cyst to see what is the cyst, is it increasing or decreasing, what is happening. These kind of problems, based on the clinical scenarios, certain tests will be added. So, but the maximum effect or load on the heart will come by 32 weeks. So, if any woman is suddenly feeling breathless or too much walking, if even I am resting, I am feeling discomfort, in those kind of women, better to get one ECG and echo done from the cardiologist. Opinion taking is good, because of the pregnancy hormones influence and the overload, volume overload. Heart can have pressures, BP can shoot up, heart can be pumping slowly, or heart can increase in size. Okay, so these can cause problem during the delivery. So for that reason, if any problems is happening to you, you have to inform to the doctor so that they can evaluate for these things. So the tests, it depends how frequently, it depends whether you have low hemoglobin or normal hemoglobin, and low sugars or high sugars. So it depends. Apart from the routine test what it is done, extra tests, it depends on you, your clinical situation, your doctor will advise. When advised, don't think that why doctor is repeatedly doing the test, because if any treatment is given, we need to evaluate whether the treatment is successful or any other medicines has to be added. So always do the test when advised, and follow up the doctor and meet the doctor and discuss the other treatment options. These are the basic tests. Apart from this, there is something called a non-invasive prenatal testing. This is NIPT test. We don't advise routinely to be done. High risk patients we do advised, but we give the information to the pregnant couple. If they are keen for doing for the pregnancy, they can do it. Okay. What is this NIPT test? From the mother's blood, they extract the fetal DNA and do the chromosome study, which is almost 99 to 99.5% reliable for the genetic diseases. As I mentioned, the first trimester quadruple marker, which is 95% reliable for the genetic diseases, this is still more accurate. This option we give to the all pregnant couple. So if there certain patients we tell that it is mandatory to do, certain patients we give the information, the pregnant couple can decide whether they want to go ahead with this test or not. Apart from that, there are certain tests like amniocentesis, chorionic villus sampling. These kind of things, the scenario will come when medically indicated, doctor will advise. If it is necessary, you can undergo the test amniocentesis, because having an abnormal baby is lifelong suffering for the baby and you. Don't be worried about that 1% risk of water breakdown, leaking thing, miscarriage risk, because the test information is almost 100% accurate to evaluate the genetic diseases for which there is no treatment. So properly get tested when necessary and follow up with the doctor. This much tests are done, the antenatal period is very smooth, and if anything necessary, it will be advised that you can do it.